My name is Simon Farmer, Dr. Simon Farmer. I am consultant neurologist at the National Hospital for Neurology and Neurosurgery, which is based in Queen Square, central London, and closely affiliated with University College London Hospitals and the Institute of Neurology and University College London. I've worked here for 30 years now as a consultant, and I graduated from Bristol University 10 years before I started work here. My specialism, I think I would consider myself as a diagnostician, so a person who has general neurology as their focus, although I do have subspecialist interests in movement disorders, neuro-ophthalmology, and the neurology of, or the medical neurology of the spine and spinal cord. But most of my patients come to me for a diagnosis. My research has been going along in parallel with my clinical career, although I'm very much an NHS clinician who does private practice here at the National Hospital. My research is, my PhD students and people I've worked alongside over the research part of my career has been performed mainly at the Institute of Neurology, and is in the field, particularly in the disorders of movement, and also problems around how you engineer or reverse engineer from brain signals what's actually going on in the living brain in the dynamical situation. So I take the research bit of it very seriously, and it does inform my practice, particularly in the area of Parkinson's disease. Research is a very important part of what this hospital does. It's an internationally renowned hospital for neuroscience research, and it's been shown time and time again that the hospitals that are most research active are those that give the best and safest clinical care. So, people do ask, what's it like day to day? And I would say, for me, diagnosis, accurate diagnosis, rapid diagnosis is the key, because neurology is complex and it allows a high level of conversation to take place between the physician and the patient, where one can not only deliver whatever news has to be delivered, be confident that what we're discussing is the truth, and also plan positively for how to cope with this situation, and that's very important for people with the particularly diseases of the nervous system which are hard to diagnose, some of which don't have an obvious cure but can be managed. What I value about doing any private work is the fact that it's a longitudinal process. You can see someone, get to know them, become quite good friends with them, and then support them with whatever condition they have to be supported with. I want to be friendly, not make light of a difficult situation, but get alongside a person and their family and their loved ones and try and support them as best I can.